Hello, my name is Lizzy. I'm a dietitian and I work at DePaul Hospital. So today I will be doing a presentation on how to stay well while working from home. So just a little background about me. So I've been a dietitian for the last 2 years. I work as an inpatient dietitian at DePaul Hospital. I also work in the outpatient setting, doing diabetes counseling, as well as for chronic kidney disease, cancer care. I also work at weight management at DePaul Hospital a couple days a week, where I provide weight loss counseling for patients seeking weight loss surgery and those who would like non-surgical interventions. So thanks for inviting me today, and I think this will be fun. All right, so an overview of today's presentation. We'll talk about some of the healthy components of a well-rounded diet. We'll talk about meal planning while you're working from home, as so many of us are. And we'll talk about how you can modify your environment, whether you are at home or in the office, and try to get an active lifestyle in there. So to start off with, what makes a diet healthy exactly? Rather than exclusively focusing on, fad diets, which may, cut out entire food groups, we want to focus on what the research really shows. So research shows that having a well-rounded diet that incorporates fruits and vegetables, whole grains, healthy fats, and lean proteins is the best way to lose weight and keep it off long term. A lot of times these fad diets simply don't work because they cut out entire food groups. You may have found that maybe once you started dieting, you lost some weight, but then when you stopped dieting, that weight came back. So it's not really teaching us to eat in a sustainable way that we can follow long term. Some of these diets in particular that I'm thinking of are things like the ketogenic diet, the very low carb diet. They do cut out entire food groups, and it makes it really hard to follow these diets for more than, a few weeks. Some people are able to follow it for 6 months or a year, but a lot of times there comes a point when it becomes unsustainable. So we really want to look for something that you're going to be able to follow long term, that's going to provide you all the nutrients that you need and doesn't make you feel deprived at the same time. It's also important to balance your nutrients. So one thing I like to start off with is looking at portion sizes. We know that portion sizes have increased in the US. Part of that is due to perhaps consumers wanting more and wanting a good value from their plate sizes and from restaurants. Diets are also higher in carbs and fats than they are now. So a lot of times we just see, an overabundance of carbs on people's plates, and maybe too many fats are added in, and not enough focus on things like fruits and vegetables and lean proteins. We also see that hunger cues, may be ignored. So a lot of times what I see as a pattern is that, patients are eating when they're not hungry and not eating when they are hungry. So those hunger cues are really being thrown off and we're not listening to what our body actually needs. So what we can do is try to reset that, really think about mindful eating, and trying to get our bodies back on track with listening to when it's truly hungry, maybe when it's truly thirsty and not hungry, and to avoid excess snacking in between meals when we don't necessarily need them. So this slide right here, I really like to illustrate the point of portion sizes and plate sizes. So we know that in the 50s, the average plate size in the US was about 8 or 9 inches in diameter. Nowadays, the average plate size in the US is about 11 inches in diameter, and if you go to a restaurant, it's going to be about 13 inches in diameter. What that does is it kind of creates this optical illusion that the amount of food that's on your plate is the appropriate serving size, when in fact, restaurants will often serve you 2, 3, sometimes 4 times the actual serving size. So, filling up our plates, is something that's normally taught in childhood that we want to fill it up and we want to eat all of it. But the portions that were served today really aren't appropriate for how many calories we burn day to day. So you can see that this plate right here, which is about 8.5 inches, it holds a well-balanced meal. It's got a little protein from the tuna, some carbs from the wild rice, and then a cup of carrots, which is a good amount. So you can see half their plate is vegetables, which I really like. But you can see the calorie amount is about 253 calories. So, that's a pretty lean lunch, based on most people's standards. Whereas if you get a big 12-inch plate, let's say that this is out at a restaurant, you can see that the calorie amount is about 660 calories. But if you look between the two plates, they're proportioned pretty similarly. The only difference really is that the plate size is much bigger. So instead of 3 ounces of tuna, it's holding 5 ounces. Instead of half a cup of wild rice, it's 2 whole cups. And to be honest, when you see some of these healthy meals that are designated as healthy meals, when you go out to restaurants, this is usually how they balance it, and their calories are probably about 500 or 600 calories per meal. So you can see that you can get a couple of servings out of that simply because the plate size is much larger and there's just a bigger, there's much more real estate, as I like to call it, to fill up on that plate. So simply changing your plate size can make a world of difference. When you serve yourself on a smaller plate, and you fill it up, like you would a larger plate, your eyes are going to see that, okay, there's a full plate in front of me, which means that I'm getting a good amount of food at this meal. So you're going to have that sense of satisfaction before you even start eating. I also really like this slide, which I know it's a little bit hard to see and it does have a lot of information on it, but especially when I teach my nutrition students, this really illustrates how we can change the types of foods that we're eating to equal a better balance of calories. So the servings on the left side, these are pretty calorie dense foods, meaning that for each bite that you're taking, there's a lot of calories in each bite. Whereas the one on the right is less dense foods, but they have a lot of nutrients. So meaning they have lots of vitamins and minerals for each bite, but they aren't very dense in calories. So the one on the left, if total for the day is about 3,300 calories. The one on the right is about 1,700, which is probably more appropriate, especially for someone who's working out quite a bit and is pretty active day to day. You can see that the volume of food that they're eating, how much, is not that different based on the two different foods that are chosen between the different meals. But what's different is that on the left side, you've got some foods that are really dense in calories. On the right side, you have foods that are not very dense in calories. So they're still going to fill your stomach up the same, but you're going to get much less calories from this side. For instance, for their lunch, instead of having chips with their lunch, which are going to be at least 150 calories, they've got some carrots and broccoli, which are going to be about 50 calories. So that cuts it down, but they look about the same size. Instead of doing, a big serving of rice and a big serving of corn, both of which we would categorize as starches, they do a little bit of rice and a lot more veggies, which are going to cut down on calories immensely. So this is just ways that food choices really do make a big difference at the end of the day when you look at calories. We also need to distinguish between serving size versus portion size. A portion is how much food you're going to choose to eat at one time, whether that's in a restaurant or what you make from your own kitchen. So this is 100% up to you. Many foods that are single portion actually have multiple servings. So like I was saying earlier, many of these restaurants, they'll serve you what they think is one portion, but really it's only appropriate to eat half, a third, maybe only a quarter of what's on that plate. And that's going to be the portion, is how much you choose to eat. Now, a serving size is what's listed on a food product's nutrition facts label. So if you've ever, purchased something from the store and looked on the back of the box or package, you'll see a food label that lists nutrition facts. And it will have a serving size that tells you based on this serving size, which, could be one piece, 1 cup. This is how many calories are in that serving. So it's important to distinguish between the two. Sometimes a serving size, which is on a nutrition label, doesn't reflect what a normal person eats. For instance, sometimes you might buy, let's say, a muffin, from the grocery store, and a serving size for that muffin is half of a muffin, which is misleading because it looks like it's, not that bad for the calories. But most people don't eat half a muffin at one time. So you have to make sure you really look at those serving sizes on the nutrition facts label to make sure that you're eating what they're actually recommending. So when we're looking how to control our portions, especially when you're cooking at home, make sure that you're offering the proper serving to each family member, and then you put all the leftovers away. So we don't want to leave that food out where it's accessible. I think we've all experienced, when we cook a meal, it's really good, and we go back for seconds. Or maybe we put all the dishes on the table so everyone can self-serve, and you keep spooning out more and more as you empty your plate. We want to make sure that we serve that beforehand and then put everything away before we start eating so it's not out where we have access to it. When you're dining out or maybe getting takeout right now, try to skip the appetizers, the chips, the salsa, the breads, any appetizer, because a lot of times these appetizers have more calories than the actual meal, and they don't really have a lot of nutrients that are beneficial. If you're getting a meal to go, try splitting it or making it into smaller portions when you get home by boxing up half or maybe 2/3 of the meal and putting it in the refrigerator. So then you have your leftovers for the next day and you're eating appropriate amount of food at that sitting. Also try to, at snack time, monitor what kind of snacks that you're eating. Make sure that you have plenty of healthy snacks at home available and your pantry isn't full of foods that might tempt you. I know it's hard right now with everyone's kids at home, especially if they're at home more often during the day and maybe you're working from home during the day. It's hard to avoid some of those snacks that are there for the kids, especially those very carby snacks like pretzels and goldfish and Cheez-Its and crackers. But we want to make sure that you have a good snack too, that will help keep you stay on track. So buy things and prepare things for your snacks. Portion them out, before the day starts so that if you do go into the kitchen and you're wanting something, you have an appropriate serving size already in the refrigerator for you. So you can bypass that pantry and all the snacks that your kids might like that are in there. And then tracking your calories can be very helpful. Tracking your calories can help you monitor your portions. You might find that, okay, it looks like I'm eating a little bit too much at snack time, and that's what's throwing my calories up at the end of the day. So that's a good way to figure out where your calories are coming from, and how you can start adjusting them so that you still get the right amount of nutrients for the day, but you're not going overboard on the calories. All right, so for meal planning at work, I know some of us aren't working in the office right now, but we still have to plan our day in advance. We want to make sure that we set ourselves up for success before the day starts. So remember not to skip meals. It's really easy to skip breakfast or skip lunch, especially when you're trying to rush into the door or the office and to get your day started. But skipping meals is really not beneficial for weight loss. I know especially with some of the fads like intermittent fasting, they kind of encourage you to skip meals, only eat for so many hours during the day, which means you can't fit 3 meals into that plan. But I would encourage you to be a little more flexible with that. Maybe instead of only eating 8 hours a day, extend it to 10 hours a day so that you can fit a breakfast in. The reason for this is that skipping meals can actually lower your metabolism. So your body's going to slow down how fast it's processing the foods that you eat, meaning you're burning less throughout the day. It can also lead to overeating later in the day. So oftentimes when we skip meals, we justify eating larger portions or eating something we wouldn't normally choose later in the day because we missed a meal earlier in the day. And what happens is that, especially if it's the first meal, your breakfast, I find that the calories you eat later in the day are far exceed what you would have eaten at breakfast. So make sure you get a breakfast in. Remember, coffee is not breakfast. We also want to plan your day ahead of time. This means planning all of your meals and snacks. So if you're going into an office, packing those foods before you leave is really important. If you're working from home, the same principle applies. Make sure you have something healthy for breakfast and lunch, and that you've got some healthy snacks planned out for the day. If you always get hungry at a certain time in the day, make sure that you've got something planned so that you're not spontaneously trying to find something to eat and then potentially making the wrong decision because you're very hungry. An example of this is I'm always hungry on my drive home from the hospital. That's about 4 o'clock. So when I don't pack a snack, I'm really tempted to come home and find that pack of Oreos that my husband has in the back of the pantry. Whereas normally I would not make that decision to eat Oreos. I'd find something a little healthier, a little better protein, maybe some fiber to eat instead. So what I've started doing is making sure I have a protein drink or a protein bar in my bag that I can eat on the way home so that when I do get home, I'm satisfied, I'm full, I'm not overly hungry, and I can wait until dinner time. What I have listed here are some ways that you can start with meal tracking if you're interested. So you can use apps like MyFitnessPal. This is the Samsung Health app if you have a Samsung phone. I really love this app. I use it all the time. Or you can simply use the plate method if you're not ready to take it to that step. So the plate method talks about looking at your plate and building it, based on these certain ratios as a way to help control calories and make sure your diet is still staying well-rounded. So this is also a way that you can use a plate method to set your day up. So we use this quite a bit at weight management for patients who don't yet want to use meal tracking as part of their plan. So what we have them do is do a protein shake for breakfast. Then at lunch, we want them to do half of their plate full of colorful foods, that's fruits and vegetables. A quarter of their plate being a lean protein like tuna, chicken, salmon. And then we want them to have a little bit of carbs, but they've got to be full fiber carbs. So that means fruit, which has lots of fiber. That means whole grain starches. So that could be wild rice or brown rice or quinoa or whole wheat pasta, whole grain bread. So it's got to be a lot of fiber in those carbs. And then they can have a side like yogurt or salsa to put on their vegetables or some dressing to put on their salad if this is a salad. And you can switch the breakfast and lunch if you'd rather have a full breakfast and then just do a protein shake for lunch. They're allowed one snack a day, and it's got to be some type of veggie with a protein. So that could be, let's say, like carrot sticks and hummus. That's a protein, a hummus. And then the veggies would be, of course, their colorful food. That could be some fruit and maybe a cheese stick. So you can get creative with that choice. And then their dinner has to be half protein, half fruits and vegetables, or just vegetables if you don't want to do a fruit in the evening. So what does that meal plan look like? So this is kind of how it is if you're going to eat your meals prepared, throughout the day, how you can set it up and what that looks like. So here we've got a protein shake for breakfast. I believe this is a Smoothie King Slim and Trim, which is my favorite. Then they've got their colorful foods right here on half of their plate. Their full fiber carbs of wild rice, their protein, and then they have a side of cheese for a little extra protein. For lunch, for their veggies, they've got carrots and celery, and for their protein, they've got some hummus. And then for dinner, half of their plate is protein. They've got chicken in here. And then they've also got some really colorful foods, the veggies, the fruit, and then their side would be the dressing that's on the salad. So this is a way you can set that day up following this meal plan. I think this is a really easy way to do it because you can print this guideline off and tape it to your refrigerator and plan your day based on the foods that you already have at home. This is an example of how you would plan that day if you're going to be out all day. So how do I plan my day if I'm going to be eating out all the time? So there's a way to do it. Like I said, Smoothie King has a great protein shake. The Gladiator or the Slim and Trim is great. Let's say you're getting pizza for lunch. Only make half of your plate that pizza and get some protein on there. Like this has got grilled chicken. So that's one, maybe two slices of pizza. And then the rest of your plate needs to be a big salad. Let's say you're going to Starbucks for a snack. Maybe you're getting that afternoon caffeine fix. They usually carry bananas and yogurt, and that could be your fruit with your protein. And then let's say you're going to Panda Express in the evening. Their broccoli beef is about 300 calories. It's half protein, half vegetables, and that would fit our criteria as well. All right, so let's say someone brings sweets into the office, or maybe instead of your coworkers bringing in sweets, it's your family bringing in sweets into the home. So remember that we don't want to cut out all foods forever. We want to make sure that you're practicing mindfulness and you're allowing some flexibility within reason. So try to think about portions with things like sweets. Consider maybe instead of doing a full slice of cake, we do a small sliver of cake, and then we have some fruit with it or a yogurt to make sure that we stay full. Consider trying to keep these foods out of eyesight. So if you have this candy bowl that's sitting out at your desk, it's really hard to resist if it's sitting right in front of you. So keep it in a covered jar where you can't see through it. Put it in the pantry if you are able to do so. And try not to keep any of these things out on the counter. There was a study done at Google, actually. They had peanut M&Ms that were in these clear containers in their break rooms, and they found that just by covering up the containers, meaning making them so you couldn't see through them, that drastically reduced how many peanut M&Ms the staff was eating every day. So that was a simple thing that you can do to help reduce how many sweets you're having. Also think, can I fit this in my calorie range for the day? If you know that you're going to have some type of dessert, maybe it's a birthday party, or maybe it's someone bringing donuts in for breakfast, and you're following your calorie amount by tracking it on an app, figure out, can I fit this into my calories for the day? Maybe you can. Maybe you can, make a light breakfast where you just have a protein shake so that you can enjoy that donut and not feel guilty about it. So those are ways that you can make it work that doesn't completely cut out these foods. And remember to set your environment up for success. Hiding sweets and high carb foods from your work area or home. Use a fruit bowl. Keeping a fruit bowl out at your station or in your kitchen will help encourage you to eat more fruits. Keep a designated area for work and a designated area for eating. So don't eat in the same place that you work. Try not to do your work in the kitchen if you can, because then you're not thinking about food, you're not looking at the food, and it separates the work from the eating. So to kind of wrap this up, I think I'm running short on time. Try to also implement an active lifestyle. I know that's hard even when your job isn't active to do so, especially if you sit for long periods of time. So try to challenge yourself to get up at least once an hour and stretch, maybe take a short walk, walk to the bathroom or the water cooler, or to fill up, your water bottle, just to get you moving every hour. Are there times in the day when you can take a walk, perhaps lunchtime or a 15-minute break in your schedule? A lot of times if I have a patient who, I have a cancellation or I have an extra 15 minutes between seeing people and I haven't been out and about much during the day, I'll go take a short walk, around the department or around the hospital to get in some extra steps. And then you can also challenge your office to make an exercise plan. I know right now with COVID, it is hard to do so when you're not with the office, especially. But encourage them to provide standing desks or maybe take an exercise ball to work to sit on that. That will help you engage your core as you're working if you're on an exercise ball. And also, try to take these qualities home too. Try to be active with the family as much as you can. Remember that any movement is good. So this could include, hiking, biking, walking around at the outdoor mall, doing some yard work. Maybe during your kids' practice or soccer games, you can do some walking around while they're there. And try to get your kids involved if you have them at home. So, if you only have time to do these activities, maybe on the weekend when they're out of school, try to think of things they would enjoy to encourage the whole family to get out and about. So maybe that's, playing jump rope or hopscotch, or taking a walk down to the park, taking their bikes out, things like that while the weather is still nice are really important. All right, so what we talked about today was looking at portion sizes, using smaller plates and measuring out our foods. You can also use a plate method as a good guide, setting your plate up with lots of fresh fruits and veggies and limiting the amount of carbs you have at each meal. And then ways to modify your environment. So, making sure that at home or at work, you don't have any of those temptations in your work area, and that you're not skipping meals even if you do get busy. So, making sure you have a plan in place to schedule your meals and snacks so that you don't become overly hungry and make a choice you wouldn't normally make. All right, and now I think it will be a great time for some questions.